Hello guys, this is Rupa Yadav. Today I come with my video head or neck carcinoma, or we can say in other word head or neck cancer. So those who are not subscribed my channel, so please go my channel, YouTube channel, and for subscribe my this channel because of our next video we will always update it and you will get notified. So, if you have any doubt, any comments, so please keep some comments on my comment box and also subscribe my channel and press the bell icon. So, now let's start. Head or neck carcinoma. When we think about head or neck cancer, we are really talking about disease or cancer that occur essentially above the clavicles but not including the brain, that the brain cancer or really a different entity. So these are cancer that start in the mouth or the throat often. We see patient with a cancer that originate in the thyroid gland or the salivary gland. Essentially, that part of the body that is responsible for speech or swelling and communication. Now, today we will briefly discuss in the head or neck carcinoma that develop from tissue in the lip or oral cavity, that is mouth, larynx, throat, salivary glands, nose, sinuses, or the skin of the face. The most common type of head or neck cancer that occur in the lip, mouth, and larynx. The symptoms that occurs or include a sore that does not real a change in the voice or some experience that a sore throat that does not go away. This advanced disease, this may be unusual bleeding, facial pain, numbness or swelling, and visible lump on the outside of the neck or oral cavity. And also the location of this cancer, trouble breathing may be present there. So, the head and neck carcinoma is a majority of the cause by use of the alcohol or the tobacco. And those who including smokeless tobacco with the increasing cases link human papilloma virus, that is HPV. And some other risk factor is also include, that is Epstein Barr virus, battle quad, radiation exposure, and about 90% are the pathologically classified as a squamous cell cancer. And we will confine that the carcinoma with the help of tissue biopsy, the surrounding tissue inversion and distant spread may be determined by medical imaging and blood tests. And the most of those cancers start on the surface, what we call the mucosa of those areas, the lining of the mouth, on the throat, or the tongue. Types of head and neck cancer. Now we will talk about the types of head and neck cancer. The primary type of head and neck cancer we really put into, and I think the major categories, there are three major categories and they are based on their origin in term of the tissues. So the main type, and I would say that accounts for 90% of the cancer that we see, that is we call squamous cell carcinoma. Those are cancer that start in the lining of what we call the upper ear digestive tract, so the mouth, the throat, and the upper esophagus, the voice box or larynx, the upper trachea. These are all lined by a mucosal surface that when there is a cancer from it, we call those squamous cell carcinoma. Then the second most common are thyroid cancer. They come from the thyroid gland. Those fall into a couple of categories, either medullary thyroid cancer, or what in broad term what we will call differentiated thyroid cancer. And then the third categories that we see most often are cancer that start from the salivary glands or a salivary gland cancer. Signs and symptom of the neck and head carcinoma that include some of the face or oral cavity that does not heal, trouble swelling, or the charge in the voice and the change of the voice. This carcinoma advanced disease, there may be present unusual bleeding, facial pain, numbness or swelling, and visible lumps on the outside of the neck or the oral cavity. Head and neck cancer begin with benign sign and a symptom of disease, like an enlargement lymph node on the outside of the neck. The voice are the hoarse surrounding voice or the progressive worsening cough or a sore throat. In the case of the head and the neck cancer, there all symptoms will be notably persistent and become chronic. There may be a lump or a sore in the throat and the neck that does not heal or go away. We also see the difficulties or painful swelling are also present there. There may also difficulty in speaking and earache. Earache means ear pain. The other symptom like a lump in the lip, month, mouth or gums, ulcer or mouth sores that does not heal, bleeding from the mouth or the numbness. Bad breath, discolored patches that persistent in the mouth, a sore tongue, and slurring of speech. If the cancer is affecting the tongue, the present congested sinuses, weight loss, and some numbness or paralysis of the facial muscles. Squamous cancer are common in area of the mouth, occur inner lip, tongue, floor of the mouth, gums, and hard palate. Cancer of the mouth are strongly associated with a tobacco use, especially use of the chewing tobacco or dipping tobacco, as well as heavy alcohol use. For this reason, cancer present in the tongue are more frequently treated with a surgery than the are other head and neck cancer or carcinoma. In oral cancer, the surgery performed like a maxillectomy. In that, we are defined maxillectomy that uh, can done with or without the vital extenuation exenteration. And the next point, the mandibulectomy, that is removal of the lower jaw or a part of it. And the third point, the glossectomy, that is the tongue removal, can be total, that is hemi or the partial. And the next was the radial, that is neck dissection. And the combinational, that is example for galaxectomy and the laryngectomy done together. The defect is a typically covered improved by using another part of the body and or the skin grafts and or the wearing a prosthesis. Now we will briefly talk about the potential for cure. What was the potential about the cure? We have take the about these steps in the head and neck carcinoma. Now let's start. When we think about a head and neck cancer diagnosis. And when a patient get a diagnosis of a head and a neck cancer, one of the things that they need to begin to think about are what their potential of cure. Yeah, for cure, it's a potential for organ preservation. Let me expand on both of those. Let me expand on both of those in a term of the this disease. The majority of the patient that we see present with what we call local regional disease, and when we mean by that, it is present that they have a tumor that often has spread to lymph node, but has not spread, so no metastases to other organ like the lung or the bone or the liver. What we are really talking about in disease that is confined to the area of the head and neck, and that is important because those patients we would consider for a curative instant therapy, and that become obviously first thing that we think about when we see a patient with a head and a neck cancer. Is this the patient that can be cured of their disease? If they are, that obviously takes us down a road of what we can do to cure that patient. And if they are not, that takes us down a completely different therapeutic avenue. Then we begin to think about, well, as you can imagine, because the organ of the head and neck are so critical to day to day interaction to really what define us as a human being, our ability to talk to each other, the other ability, our ability to have a meal, to eat normally, our facial expression, so much of, but what we do as people, as a human happens above the clavicles, and so functional preservation becomes so important in the patient with a head and a neck cancer, especially one that we are going to try to cure. So the next question that we are asked is, how can we exactly the question that patient we cure the patient and return them to normal function, and exactly the question that patients should be asking their physician: do I have, can I be cured of this? And if I can be cured of this, how can I maintain my normal activities once I am done with a therapy? And then we need to think about what are the other medical professionals that are going to be important in this person's care. So because many patients have will get radiation to the mouth or the oral cavity is going to the included in the radiation fluid, dentist and the dental professionals become incredibly important to the ongoing care. You can imagine that as we are, as patient go through therapy, they are going to have trouble swelling, so nutrition and speech and swell therapeutics become incredibly important. Now let's, we are talking about the treatment option, what we have a take a treatment or take a step about the treatment to the patient for cure the patient. And we are back to the idea that many of our patients will present with a local regional disease. The main treatment option really focuses on curing the patient. And when we are talking about curative in a instant therapy, we are really talking about three major modalities, that is surgery, radiation therapy, and the medical oncology or chemotherapy. And what we have done really for the last couple of dreads is learn how to integrate those three modalities to produce the best outcomes possible for some patient. It is going to be surgery upfront, possibly followed by a radiation or the chemotherapy and radiation for other patient. We want to, and for many patient, we want to think about a non-surgical approach in an attempt to preserve function and preserve the organ. I do believe it's very important to ask about clinical trials, because not only is this the way that we move the fluid forward, but honestly clinical trials over novel therapies to patient, new approaches to patient, that very often prove to be the next standard of care, especially now with the excitement around immunotherapy. So I think it is very important to ask what clinical trials are available to me or for the disease. That have beyond that, I think the important thing to ask are what should my categories or caregivers to thinking about, what support team do I need to have in a place, and it is go to good think about that proactively get that is place, how much help will I do as go through this treatment, and who is going to be available to supply this that help. Now we are talking about latest research development. When we think about where the research is going, and the most recent research advance in head and neck cancer is really like to group them into two categories. The first is what we are learning about the cancer and out better understanding of really the biology of this disease, and the second falls into what are the new therapies, what treatment are coming on it or about to come for it, that we can talk advantage of it improve for the patient. But we are learning that clearly there are two distinct type of squamous cell carcinoma, the head and neck. One is related to the virus called the human papilloma virus, that is HPV. The same virus causes cervical cancer and some other cancers. We are understanding that HPV related head and neck cancer behave a lot differently than a non HPV related head and neck cancer. And what I mean, but that is the patient tend to be younger, they are often non-smoker, non-drinker, and that is a real, that is a very important thing to point out, because we are learning as a practitioner is that the patient don't need to smoke to be at a risk for head or neck cancer. And in the non-smoker, we need to be still concerned if anybody begin to complain of a symptom around the head or neck area, that pain or lump in the neck, we need to be very concerned and begin to think about in this possibly a viral related cancer. Even a non-smoker, a patient of the course should be aware of that as well. So HPV positive head and neck cancer because differently. And then HPV negative cancer, which is often related to tobacco exposure, occur in patient who is a little bit older and it has a different presentation in term of where it occur. It often occur in the voice box or the oral cavity, and again it is often associated with especially a cigarette smoking. We have also begun to understand that there are mutation and alteration test we can target specially. So for instance, those are patient who have a mutation in a cancer pathways or in the certain genes, that now we have drug that specifically target those genes. Let have also begin to understand that immunotherapy is going to play a incredibly important role in this disease. For both HPV persistence is now HPV related head and neck cancer, and that we seeing some incredible excitement data with with the first wave of immunotherapy drug in this disease. In fact, now we have randomized data of a immunotherapy drug when versus standard of care in patient that are current in metastatic disease that are showing a dramatic improvement for immunotherapy. And truly this is just the first step, the first drug that has shown this type of efficacy. We are going to see many more in the next 4 months, and so explanation really in the next 4 year for immunotherapy in the head or a neck cancer. So now we are talking about the where to get more information about the neck carcinoma. For head and neck carcinoma, there are some especially relevant website. This is the my YouTube channel, and you can watch this video and you can understand the head or neck carcinoma. So thank you. I hope you enjoy my video, and thank you for watching this video.